Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another commonly asked question, why internal medicine? So for answer this question, actually we need to let the interviewer know that at least we have a basic understanding of this specialty, internal medicine. And actually for this question, it doesn't have to be the internal medicine. It can be any specialties like a surgery, or OBGYN or pediatrics. But as I mentioned, at least we need to let the interviewer know that we at least have a basic understanding of this specialty. And if you were previously trained as a physician, you can definitely talk about your feeling of this career. For example, you can talk about you choose internal medicine because you like communicating with patient, you like a challenge for the diagnosis, and you like seeing patient get recovered after treatment, and you can talk all of those things. And if you're previously trained with different specialties like OBGYN, surgery, or pediatrics, you may talk about your understanding of internal medicine, but more importantly, you need to let them know your previous or recent experience in internal medicine. So that's why I strongly recommend you to get some USCE related to the internal medicine first, in order to get a good ROR, in order to get a good experience, in order to convince the interviewer that you have experience in internal medicine, and all of and you can and then you can further talk about your feelings during the training, and to convince the interviewer that why you choose the internal medicine. And at the end of your story, I would say that you can summarize the reasons why you choose internal medicine, and also you can say something that because of your program, like the interviewer's program or program director's there's a program, so has a very solid clinical training opportunities for the resident candidate uh, who want to become a physician. So that's why you want to continue clinical training in their program. So you can definitely talk about something about that at the end of your story. Now I'm going to give you my answer for this question. Hey, Dr. Cui, can you tell me why do you choose internal medicine? Yeah, that's a good question. I would say that when I was a medical student when I was a medical student doing clinical rotation, uh, I thought that physicians is just like a detective. Whenever we saw a patient, we ask them questions, collect their histories, and and do the physical examinations as well as other tests in order to collect all of those evidence from the patient. And then we finally make a correct diagnosis, excluded all other possibilities, and in order to give the patient a correct, appropriate treatment. And finally, the patient get recovered, which is so amazing. I really like this process, and I really like those challenges for those rare cases. And I really just I like seeing the patient get recovered with our help. So I would say that all of these reasons drive me to pursue this career, to choose internal medicine. And also, I heard that your program has a very solid clinical training for the for the future resident doctor. So that's why I would like to continue my clinical training in your program in order to pave the way for my future fellowship application as well. So I would say that I'll put them together. That's why I want to choose internal medicine, and I want to choose your program as well. So you can see that in my answer, I give the interviewer why I want to choose internal medicine, and I talked a lot of details for that, which covered all of the points I mentioned above. And at the end of my story, I also mentioned a little bit that why I want to choose your program, because because your program has a very solid clinical training, and which is helpful for my future fellowship application, something like that. So in order to impress the interviewer, give the interviewer a reason that why I want to choose the internal medicine and why I want to continue clinical training in your program. So I hope you will also create your own answer with my help. So good luck.